COVID cases are rising in some parts of the country and the world again, even with vaccines widely available. Earlier Monday, President Biden's chief medical advisor, Dr. Anthony Fauci, sat down with CBS Mornings anchor Gayle King to discuss the rising infection rate. Dr. Fauci warns that the holidays could stand to be a time of increased transmission.
As you go into the colder weather, as you go into a season where people travel, where people congregate, and you have a virus that is as transmissible as Delta, you have an issue if you're not vaccinated. And even in a situation where we have highly effective and safe vaccines, we still, Gail, we still have 60 million people in this country who are eligible to be vaccinated who have not been vaccinated.
For more, I want to bring in Carl Zimmer. He's a columnist at the New York Times. Carl, good to have you on the program again. Thanks for being with us. So COVID cases are again on the rise after they've been declining over the summer. Do we know more about COVID's spread in the different seasons?
Well, you know, when winter comes in colder parts of the country, people go inside. And when you're dealing with a virus like the coronavirus, it's going to be floating around in unventilated spaces. So you're going to expect that people are going to be exposed to it more. It's inevitable.
So Austria is requiring COVID vaccines for its entire adult population and going on lockdown. The World Health Organization is calling Europe a hotspot for the virus once again. Why are things looking so dire in Europe?
Well, you know, I think that they have relaxed a lot of their other measures, and aside from vaccination, like masking and so on, they just started treating things like everything was normal again. And they did have low areas of really low vaccination, and really it was just kind of a matter of time. I mean, you set the pile of kindling, and then you just keep throwing matches on until it catches fire. And now they're really having incredibly high skyrocketing cases.
So a Monmouth University poll released last week finds a majority of Americans plan to spend Thanksgiving as they did before the pandemic. What have we learned about holiday correlations to case counts?
Well, we went through the holidays last time with this virus, and we saw a big spike. And it's not surprising because people travel, so they're getting exposed in airports and other places, and then they're coming together again in indoor spaces. You know, now, you know, we have vaccines and so on, but unfortunately, it looks like people really aren't caring that much about whether they're going to be having Thanksgiving with people who are vaccinated or not. They're not going to be asking. They're not. Doesn't seem like there's going to be a lot of testing, which is too bad because we're not out of this. People would like to pretend that we're out of this, but we're not. We're having almost 100,000 new cases a day on average. We're climbing up. It's 29% higher today than it was 2 weeks ago. We're on the incline, and so you have to take this virus seriously.
Well, after struggling to meet demand, vaccine supply has been fairly consistent, more so than testing. What do we know about the demand for boosters?
Well, you know, boosters are having a pretty strong demand, again, among people who are already vaccinated. So, you know, everybody 18 or over is now eligible to be vaccinated. And then there's been a pretty strong demand. But again, there are maybe 60 million people in this country who are not vaccinated. You know, the United States only has 58% of its overall population that's fully vaccinated. And, you know, you need to be fully vaccinated to be ready for the Delta variant. And boosters can help our waning immunity. So if you've had a vaccine 6 months ago, now would probably be a good time to get one. But, you know, it takes a couple of weeks for it to reach its full strength. So, you know, if you get a vaccine today, when you go to have Thanksgiving, you know, you're not going to have that full protection. So, you know, maybe think about that in terms of having that protection by Christmas.
Well, 5 to 11-year-olds became eligible for vaccination fairly recently. What do we know about how many kids have received at least a first dose?
You know, the demand there is pretty strong, and it's going well. Certainly, it's interesting. It's a lot faster than it was for the first, you know, same period of time for adults when adults were initially given the option for the vaccine. But we'll see. We're going to see how long that keeps going with that strong demand. I mean, there are a lot of parents who are feeling concerns about the vaccine. Some have sort of a wait and see attitude. They should talk with their doctors, and they should also take a look at the data that's come out of these big clinical trials, which show that indeed these vaccines are safe and effective. Children do get COVID. Some children can get very sick from COVID, and children can pass COVID on to other people. So those are all good reasons for kids to get vaccinated.
And finally, Carl, what have we learned about this virus since this time last year?
Oh, we've learned so much. I mean, it was really a real enigma. We know this virus, down to its individual atoms, and that has actually led to a lot of great progress. I mean, we have really effective vaccines, and the real challenge now is to get them to as many people as possible. And we also are starting to see the development of antiviral pills that could potentially be really effective for people who do get sick. So we have much better tools now than at the beginning of the pandemic. We just need to really have the resolve to use them.
All right. On that note, Carl Zimmer. Carl, always good to have you. Thank you very much.
Thank you.